Welcome to Western Wisconsin Journal. I'm Meg Heaton. For 27 years, I was a reporter with the Hudson Star Observer. I'm now retired, but through my work there, I had the privilege of meeting Peter VanDusartz, who is the director of the Valley Behavioral Health Services for Hudson Hospital and several hospitals in the area. And Pete and I have talked over the years about a lot of mental health issues and chemical dependency issues that have affected people in our community. And he's with me today to talk about mental health, which is of critical concern right now during all of this and during the COVID epidemic. And I would like to talk with him today about what services are available. And then we'll talk a little bit, hopefully, about how COVID has impacted the people that take advantage of these services. So welcome, Pete. Thanks for being with us.
Yeah, thanks for having me.
So talk to me about what services are available to people in this area.
Okay, so I work for Health Partners, and in the Valley, we have 4 hospitals and associated clinics. Those are Hudson Hospital and Clinics, Westfield's Hospital and Clinic, Richmond, Lakeview Hospital and Stillwater Medical Group Clinics in Stillwater, and Amery Hospital and Clinics. We're a part of the larger organization, Health Partners, across the Twin Cities in Minnesota. And within those different clinics and hospitals, we have a variety of behavioral health services that's integrated to our other healthcare. So I'll run through those. So first of all, up at Amery, we do have a 10-bed inpatient psychiatric unit. And related to that, we have some outpatient psychiatry, we have outpatient therapy, and we have a program there called structured outpatient, which is group therapy for people with mental health issues. And then at Hudson, we have had programs for change for, I believe it's about 33 years now. Programs for Change is our alcohol and drug treatment program, and we have expanded over the last few years. We now have a program at Westfields in New Richmond and also up at Amery. So it's our services for Programs for Change are intensive outpatient treatment. People come into the hospitals where we have our clinics and we provide that treatment. In addition to that, we have what we call integrated therapy. So in our primary care clinics where people go see their family doctor, we have therapists who are embedded in those clinics who provide outpatient therapy. That's a brief intervention model. That means that your doctor can refer you to see this therapist for an assessment, possibly some coaching and brief intervention, and if necessary, help you find ongoing therapy or treatment. In addition to that, we have grief counseling. Up at Westfields, we also have a counselor that works with the Cancer Center of Western Wisconsin that does counseling for patients that have cancer and their families. And then we also have what we call our emergency behavioral health Televideo team. This is a service that we built over the last few years in a public and private collaboration with the 3 counties human services for Pierce, Polk, and St. Croix counties. And what that means is the counties have always had a crisis response system when someone is in a serious crisis, mental health crisis, and possibly in threat of harm to self. And so we joined with them because many of those folks do come to our emergency centers. And we collaborated with outside hospitals, and we built a team that is centered at Hudson, where we do mental health assessment and diagnosis, treatment recommendations, and follow-up care for anybody who shows up in the emergency room at those hospitals. Now, that includes all 4 Health Partners hospitals, plus Osceola, St. Croix Regional Medical Center up in St. Croix Falls, Amery, not Amery, Western Wisconsin Health in Baldwin, and River Hospital as well. So 8 hospitals that we're covering for mental health crisis in coordination with the county. And then we also have built a pain clinic, a specialty pain clinic up in New Richmond at Westfields. And we have a health psychologist, actually just going to be starting here soon, who specifically works with chronic pain in a mental health way. Full mental health assessment, and then some counseling services for chronic pain. In addition to that, we are hiring a new psychiatrist who will be working out of Hudson and Westfields, sharing their time. I think I caught most of the services that we have. So it's a variety of services depending on the campus and depending on the needs that Health Partners provides.
It seems like a lot has happened in the last several years.
Yes, there's been a real investment and a focus from Health Partners, but also from each of the hospitals to provide those services. And we're able to all work together. And again, all of this is intended to be integrated with other healthcare, because mental health care, behavioral health care is healthcare. And so we want to be integrated with your family doctor, with the emergency departments, et cetera, so that we can provide total care as a part of our system.
I know that you've been working in mental health for 35 years, and I would think that, you know, in recent years there's been a lot more talk. It seems like the issue of mental health has been raised to much higher visibility than it was in the years when you were first doing this kind of work.
Yes, in fact, Health Partners joined with NAMI, the National Alliance on Mental Illness, in Minnesota several years ago, and formed a whole new program called Make It Okay. And Make It Okay is kind of an advocacy and outreach effort to change people's attitudes and awareness about mental illness and seeking treatment. And one of the primary goals of Make It Okay is to reduce stigma. Stigma is a really difficult problem with mental health issues. When somebody has a serious health issue, maybe they have an accident or they have cancer or something like that, generally people in the community and their family and friends all rally around and support and help the person through. But when a person has a serious mental health problem or a mental illness, there's often reluctance, even with the patient themselves and with family themselves, about really reaching out. And there's a lot of misconceptions about a mental illness, a lot of shame attached. So Make It Okay, what we do is we do presentations all over the community. We've been doing this for a few years now. And these presentations kind of change those messages and combat stigma. And then what we do is ambassador training, so you can become a Make It Okay ambassador. And I do a lot of those ambassador trainings myself, and there's some coming up. I don't have the calendar in front of me, but you can look up Make It Okay and find out where there is either an ambassador training or a Make It Okay presentation in your community too. Okay. I'm also involved with NAMI, and we have a NAMI affiliate in the St. Croix Valley. And so again, NAMI is the National Alliance on Mental Illness, and we offer free services for families and for individuals who are struggling with a mental illness. And so we work close together with that nonprofit free service in the community. And you can look up St. Croix Valley NAMI, and we have a web there that has all our resources listed that are free, again, free to people and their families.
Well, that's great. I mean, it's good to hear that there's so much more visibility, you know, and like you said, getting away from the stigma and talking about it openly in terms of everybody's general well-being and health. Everybody deals with this in one way or another. So,
right.
Go ahead.
I just wanted to share that one of the things we do at these Make It Okay presentations is we ask for a show of hands of how many people themselves or a close family member or friend have been affected by mental illness. And it's a trick question because we know the incidence of this is 1 in 4 or 1 in 5. And everybody knows somebody. So everybody raises their hand. And that's really the powerful message. Everybody is affected by this, either directly or indirectly.
Yeah. Well, that said, I thought, you know, it's amazing to me. I never thought that you and I would be talking about mental health issues in light of something like COVID-19 and how it's affected it. And just like it's affected every aspect of life, this virus is wreaking havoc as well with mental health treatment and mental health help. So can you talk specifically about the impact of the virus in terms of what you do?
Yeah, well, because our services are integrated with the hospitals and the clinics, we had to respond immediately to safety, patient safety and infection control, and bringing in people to the hospital and providing these services, like a lot of other businesses. So most of our behavioral health switched pretty quickly to telehealth. And that includes therapists doing counseling, psychiatry, who are doctors who see people and then sometimes prescribe medication. And even programs for change, our alcohol and drug treatment program. The problem is, on the one hand, that transition went better than anybody expected, meaning that most outpatient therapists were able to continue to see their patients, their clients. Most doctors have switched to telehealth. And at first it was phone visits, and now it's primarily televideo. And most people have been pretty responsive to that. It's, in this day and age, people are used to doing things on their phone and on their computer. So that's the good side. However, other programs don't transition so well to telehealth, especially like alcohol and drug treatment. And one of those is we do primarily group therapy, and we're intensive. So we have people coming into our treatment program 3 times a week. And we did switch over to telehealth, and we've been continuing our services that way. So has, by the way, the county human services departments switched over their services. But we have a much more difficult time doing group therapy. In addition to that, some people don't have the ready access to technology and connectivity. It's data on their phone, or they may not have Wi-Fi, that kind of a thing. And we really need to have people in to have that engagement and seeing each other and knowing each other and helping each other out, that kind of thing. And then, of course, inpatient treatment doesn't work telehealth. So our inpatient psychiatric hospital in the Twin Cities, there's lots of residential treatment, things like that. And so we've been struggling with that. And, like everybody else, all of this change is difficult to navigate in terms of billing and revenue and, licensing requirements and all of those things too. So it's been a really big impact. And because of all of that, we are now in the process of planning to bring services back onto the campus. Oh. So a good example of that is programs for change, our alcohol and drug treatment. We are now making plans to bring people back in. We are going to prioritize safety and health. Of course, we're in the hospital. So that means that our clients will be wearing masks. Our staff will be wearing masks. We will have social distancing. We've never done a group where everybody has to be 6 feet apart from each other. That's a bigger room. And it certainly will affect services to some degree. But again, we're optimistic about that, and we're determined. People have struggled who have been involved in our treatment program, for example. Relapse and being cut off and their routines being interrupted, things like that. So we are in the process, like a lot of healthcare, now bringing services back on board. That includes surgeries and physical therapy and all those kinds of things too. Yeah. A person is struggling with anxiety or depression or addiction, and their usual ways of reaching out are through a counselor or a support group. Those also have been disrupted. We're very familiar with all of the AA groups in the community, and all the AA groups were turned upside down as well. And people are resourceful. There's been a lot of Zoom AA meetings and other support groups. Even NAMI has developed some online support groups, those kinds of things. But it's been real difficult. I do know that some of the AA meetings are working to try to get back together again as well. So it's been a challenge that way. But in addition, it's really all this change, even if you, a close family member, don't develop COVID-19 and are struggling with that health issue, just all of the changes that go on are really disruptive to everybody, but even more so to people who were previously really struggling with anxiety or depression. So some of the things that come up, first of all, change, any kind of change, causes grief. Even positive change, having a baby or winning the lottery is a big change. It causes grief because there's a loss of the old way. There's a loss of routine. There's some other losses, those kinds of things. And so there's a lot of people going through grief right now. And when you add that kind of grief on top of anxiety and depression, it makes it that much harder. In addition to, change and loss, there is uncertainty. We're all dealing with a lot of uncertainty. We all have a little idea in our head about how long this will go on and when will things get back to normal and that kind of thing. So the uncertainty is just fertile ground for anxiety and having that in our face every day in the news and online, that kind of a thing. And then, as a lot of people can relate to, our personal relationships are dramatically affected, right? Partly just because we're on top of each other. There's lots of jokes and memes online that the biggest winners in all this are the dogs, right? Because we're around all the time. But of course, those changes, couples and families with their kids being around all the time adds stresses. And it's difficulty to develop clear boundaries and have those boundaries respected and, needed alone time and privacy and things like that. So there's a whole bunch of things that really have affected people, and especially those that are struggling with a mental illness.
How about senior citizens? Because I'm 68 years old, and it's taken me a little bit to adjust to the fact that I'm in an endangered species group or whatever. But seniors, I think can feel isolated anyway. But because we've been told we have to stay home and stay in our own little bubble, so to speak, what are seniors experience? And sometimes, senior citizens, even older, my age and older, aren't used to necessarily thinking in terms of their mental health,
Right. That's true. And there is a lot more isolation. And it's just not them isolating themselves. All of us as family members are concerned, and we don't want to bring risk. And so we tend to be careful, and that can close off or shut down as much contact, or getting together. Some seniors are in situations where they have a lot of community that they live in, that kind of a thing. But, there's obviously a lot of risk for them too in those settings. So it does add that kind of stress. And not only that, but services like in-home care and advocacy, all of those are affected as well, and trying to be safe and careful about infection and things like that. So it causes a lot of extra. And this is no knock on you or me, Meg, but some of us are not as adept with technology. So the resources that are available are, a little more of a struggle for people who aren't used to that. We're dealing with that with my own folks, trying to set up meetings and support, that kind of thing. So yeah, it is a much added stressor and a bigger difficulty for those folks.
Yeah, because I haven't Zoomed anywhere in many, many years. So this is the idea of Meg.
Now, Meg.
Yeah, right. How about with young people? One of the things that we've talked about in the past is, we've seen an increase in young people either attempting or completing suicide or becoming drug addicted or whatever. And then, of course, now, and oftentimes that senior year transition between college and senior year can be very, very difficult because people get anxiety about that. But this has put a whole new level on it, I would think.
Yeah. Now, in addition to everything I said, which affects all young people and adolescents too, you know, there's the bummers about, you know, the proms and the graduation and all that stuff is really important stuff. You know, that's how they're connected, not only with each other, but, you know, with their family and all of that. And then planning for the future. You know, will there be on-campus classes or living and all that kind of stuff. In addition to that, though, young people, as we know, tend to turn to each other. And so their support group is their group of friends that they're strongly connected to. And disruption in that, they're not able to get together as much either. So that's real difficult. That's real important stuff. You know, and I got to say, again, don't underestimate, you know, how difficult that loss of structure is. So as much as we might gripe about school, that kind of a thing, having that daily routine and you know, guaranteed connection with people and all of that stuff, having that gone is a very big deal, which is one of the things that people really need to do. You know, one of the best resiliency tools is to build structure back. And it may seem like not that big a deal if you're not obligated, you can just kind of be lax about things. But as human beings, we rely on structure and routine. That's a normal part of our coping, you know, and our sense of self and self-esteem and being able to count on things. And so you can build structure in. And so having routines built in, you know, and families are learning this, you know, when is school time, you know, at home. And, you know, other structures and routines, meal times and you know, just me and my siblings just started kind of doing a Zoom meeting just to stay connected. And when you schedule that stuff, it works better. So there's a lot to be said for structuring routine and traditions in this time. I'd like to say a couple more things, if that's okay, about resilience.
Absolutely.
And that can be helpful. You know, there's the big three. And again, this may seem pretty obvious and simple, but the big three are sleep, diet, and exercise. And these things affect mental health in a very powerful way. And so, you know, having that routine of bedtime and good sleep hygiene and getting enough sleep is very important. And then diet and having, again, structured meals and you know, eating healthy and that kind of thing. And exercise is really important. These things affect the brain. Sleep, diet, and exercise change the chemicals in our brain. In our recovery programs, at Programs for Change, we build that right into our treatment, that getting those things down so that your whole nervous system can count on that and gets a break and that you can affect your mood and emotion by going for a long walk or, you know, work and exercise, that kind of thing.
Yeah.
So those are some tools that are really important.
You know, this particular period of time has put a lot of stress on people. There's a lot of joking around about how much alcohol people may be consuming and what time does happy hour actually start. Are you concerned at all about people maybe abusing these things as a coping mechanism?
Yes. Like I said, I'm in the field of treatment and addiction recovery. And so I'm always concerned about that. And we see that all the time. But if it becomes a regular thing that people turn to alcohol or drinking or other substances to cope with anxiety and stress or boredom even, then that can start to become a habit. It can start to become something that people look forward to and count on. And what we know in addiction is that it's not just being under the influence that causes the problem. It's building a routine of that or a habit of that, which actually changes our nervous system. It's very powerful. And that can eventually lead to addiction. So that's even more of a concern. As far as the bars and things like that, it's understandable. People want to get out when they can, that kind of thing. But, you know, aside from the risk that it could pose for infection and spreading this virus, being a big deal and something people look forward to and can abuse it. So, yep, it's an even bigger problem. And I will add that for the people that are still in our treatment program, we've seen that. We've seen struggle with relapse and difficulty staying sober as well.
On the flip side, do you see any positive aspects to this coming out, that if people are becoming more introspective or understanding or even thinking about their mental health more than they might have under ordinary circumstances?
Yeah, I can't speak to that really with any data at this point, you know, but anecdotally and our experience in behavioral health care, I can say that, first of all, like I said, the Televideo has worked out better than we expected and has, you know, some bonuses. It's very convenient. People can see their therapist without getting in the car and going somewhere, and they like it. People really like that access and that ability to do therapy that way. And at Health Partners, we've been talking about that. There's some of this that we will continue, that this pushed us into trying out these different venues and different ways of delivering services. So that's a real benefit. And similar to that, I think people have really been pushed to connect in, you know, using technology in new ways, and they like that too. And they're making those connections. So I think that's a bonus that will stay. I don't think that will ever go back to the level that it was before. And then, you know, again, anecdotally, people are talking about their connections in their relationships, that they're closer, that they spend more time together at home and with their kids, and you know, a little bit of that, what's really important in life, and really kind of enjoying that. But when we walk around town, we're noticing that yards and gardens look much better this year. You know, people are spending time in their yard, and it's looking nice.
Yeah, it is. That's true. You wouldn't want to look at my cuticles right now, but yeah, I got a pretty good looking yard there. So,
right.
Well, thank you very much. Yeah, I like the idea of ending this interview on a positive note like that, because a lot of COVID interviews don't end that way these days. So we appreciate you being with us, and take care of yourself.
Okay, you too, Meg.
Thank you.